Alopecia is when someone loses their hair. Hi everyone, welcome to my YouTube channel My Health and Me byfun. Please like, subscribe and share. Alopecia can affect not only your scalp but also other parts of the body. Hair loss can happen for many different reasons, and it can be temporary or permanent. For some, it might just be thinning hair, while for others, it could lead to complete baldness. Alopecia can affect people of all ages and genders. Types of alopecia. Androgenetic alopecia, also known as male pattern or female pattern baldness. It's the most common form of hair loss, often seen as thinning at the crown in men and thinning all over the scalp in women. Alopecia areata causes patchy hair loss. It's an autoimmune condition where the immune system mistakenly attacks hair follicles, causing hair to fall out in small round patches. Traction alopecia happens due to pulling or tension on the hair, often from tight hairstyles like braids, ponytails, or extensions. Telogen effluvium occurs when stress or a major life event, like illness or childbirth, causes hair to enter the resting phase of the hair growth cycle, leading to shedding. Cicatricial alopecia, also known as scarring alopecia, is a rare condition where inflammation damages the hair follicles and replaces them with scar tissue, leading to permanent hair loss. There's also alopecia totalis, where all the hair on the scalp is lost, and alopecia universalis, where all hair on the entire body is lost. Knowing the type can help you understand what to expect and what treatment options might be best. There are many reasons why someone might have alopecia. Some common causes include genetics. If hair loss runs in your family, you're more likely to experience it. In autoimmune conditions, the immune system attacks hair follicles by mistake, like alopecia areata. Hormonal changes can happen due to pregnancy, menopause, or thyroid issues. Stress or trauma can lead to temporary hair loss, like telogen effluvium. Medications like those for cancer, chemotherapy, high blood pressure, or depression can cause hair loss. Lack of nutrients like iron, protein, or vitamins can lead to hair thinning. It's often like a puzzle with multiple pieces contributing. The most noticeable symptom of alopecia is hair loss. But alopecia isn't just about the physical changes. It can also impact how you feel about yourself. Some people feel sad, angry, or embarrassed about their hair loss. These feelings are completely normal. There are many ways to cope with the emotional aspects of alopecia. If you're experiencing hair loss, a doctor can help determine the cause by asking about your medical history and performing a physical exam of your scalp. Conducting a pull test, where they gently tug on the hair to see how much falls out. Blood tests to check for underlying medical conditions like thyroid issues or nutritional deficiencies. A scalp biopsy is where a small sample of skin is taken to examine under a microscope and check for conditions that cause scarring or inflammation. These tests help the doctor determine the cause of your hair loss and recommend the best treatment options for you. Depending on the type and severity, treatments can help stop hair loss or even regrow hair. Some common treatments include minoxidil, Rogaine, which is a topical solution you can apply to the scalp to help stimulate hair growth. Finasteride, Alopecia, is an oral medication mainly used for male pattern baldness. Corticosteroid injections can reduce inflammation in conditions like alopecia areata and help hair regrow in patches. Hair transplants. In more severe cases where healthy hair follicles are moved to areas with thinning or no hair. Low-level laser devices are also available to help stimulate hair follicles. Wigs can camouflage hair loss and boost confidence. Remember, the effectiveness of treatment varies, so it's important to consult with a healthcare professional for the right approach. Dealing with alopecia can be emotionally challenging, but it's important to remember that you're not alone. Many people find confidence by embracing their new look, while others may choose wigs, scarves, or hats. If you found this video helpful, give it a thumbs up and don't forget to subscribe, like, and share for more health tips.